We called it Dimitri Live. And launching this program, our objective was to engage with Canadians on issues of importance to them at a time when the media were understandably quite preoccupied with the COVID-19 pandemic. And we understand, of course, that this is a crisis that is unprecedented in our lifetimes, or at least many of our lifetimes. But we're also concerned that focus on the pandemic was causing other critically important issues to be neglected. And above all, I've come to understand in the course of my own work as a lawyer and an activist that collective decision-making is a far more humane and effective way of getting things done than unilateral decision-making. And for me, every one of these episodes has been a great opportunity to learn from colleagues who had devoted their lives and work to understanding issues of vital importance. In each of these episodes, we also involved audience members in the discussion precisely for that purpose, to learn from them and to address their own concerns. And since launching the program, we've spoken with 5 Canadians who have been doing some amazing work to address the pressing issues of our time. We spoke, for example, to a leading addiction expert, Dr. Gabor Mate, about the opioid addiction and the lack of an effective mental health strategy in Canada. We spoke with equity and anti-racist expert Kika Ojo-Thompson about equity and anti-racism, about the ways in which the Green Party in particular could be more welcoming to members of racialized groups. We talked to traditional teacher Diane Longboat about the plight of Indigenous peoples in this country, and particularly how the pandemic is affecting them. And also to social worker Maureen Reed about domestic violence and the ways in which the pandemic is exacerbating women who are confronting domestic abuse. We also spoke to Cuba-based journalist Ed Augustin about the ways in which Cuba's world-renowned medical system has responded to this pandemic. All of it was extremely enlightening, and we've begun to notice in more recent days that, in Canada and elsewhere, we're seeing some tentative signs and hopeful signs that we're beginning to emerge from this crisis. And so we all thought this would be a really good time for us to look forward about the ways in which we can emerge from this crisis with a more caring society. And to address that very question, what does the world that we're going to be living in the future look like? How can we make it a more caring world? I'm joined today by my co-hosts from the first 5 episodes. First of all, I'm pleased to welcome Wendy Goldsmith, a social worker and a social justice activist based in London, Ontario. Wendy and I have worked together on numerous causes related to peace and social justice, including the Gaza Freedom Flotilla. Welcome back, Wendy.
Thank you. It's nice to be here, Dimitri.
And next up, Atul Bahl is a retired educator based in Toronto. Atul and I have been very close friends for 15 years. We've shared many thoughts about how to make the political system more responsive to the needs of ordinary citizens and the most vulnerable members of our society. Thank you very much for joining us, Atul, and congratulations on your recent retirement.
Thank you, Dimitri. It's good to be here again, and also to be here with my fellow co-hosts.
And last but not least, of course, is Lia Tarachansky, an amazing documentary filmmaker and journalist based in Toronto. I first came to know of Lia through her work for the Real News Network, of which I'm a board member. It's a not-for-profit news organization based in Baltimore, originally set up in Canada. Thank you so much for joining us today, Lia.
You're welcome.
So during the past week, all of us, along with our the incredible campaign manager for my campaign team, Saul Botcher, we've been talking about sort of what we've taken away from these 5 episodes, and a theme that kept coming up, one that's particularly appropriate to the circumstances we're all currently confronting, is that of healthcare. And this brings me to the subject of our episode with Dr. Gabor Mate. And I thought we would play for you all a really interesting excerpt from that interview.
With individuals in terms of stressing them. So that I know that in Windsor, Ontario, for example, during the crisis in the auto industry back in 2007 or 9, whenever it was, all of a sudden the number of childhood and adolescent mental health visits went up exponentially. Why? Because the parents were stressed because of the insecurity of the auto industry. In other words, it's all one. And this society doesn't want to look at that. And I could go on and on about
Right,
the medical system.
So I think we missed a part there where Dr. Mate said that I asked him a question about the relationship between social justice and healthcare. And he was quite clear in his view that these things are intimately related. So before we launch into a discussion of that, about the ways in which social justice are impacting mental health in this country, I thought we would talk a little bit about the Green Party's platform, because it has some incredibly important aspects to it. I'm talking here specifically about Vision Green and what it has to say broadly about healthcare. One thing that it calls for is an expansion of the public healthcare system to include pharmacare and establishing a crown corporation to bulk purchase and dispense prescription drugs, the inclusion of basic dental care in our national coverage, the extension of dental care to low-income children, funding non-institutionalized community-based support for substance abuse prevention and rehabilitation programs, creating a national drug reduction strategy, and the development of more safe injection sites. That's something which Dr. Matai talked about as being quite important for persons dealing with substance abuse, regulating the distribution of pharmaceuticals prescribed by doctors to track and prevent dangerous levels of over-medication and prevent opioid addiction, and developing a national healthcare set of guidelines that incentivize active lifestyles as well as healthy diets. And finally, I should not omit, very important, treating drug addiction as a public health issue rather than a felony. So I thought maybe I'd open it up to you, Lia, because you were actively participating in our discussion with Dr. Mate. What did you take away from his discussion about whether we have a national mental health care strategy, and what we need to do if we don't in order to make that effective and meaningful for people suffering from mental health care issues?
Yeah, I mean, obviously, Dr. Mate was fascinating, incredibly well-informed speaker and an expert. For me, it was very interesting because I felt that Canada and the world needs to change the way it understands addiction in general. But he really, really expanded my mind in that regard, in the sense that, first of all, I think that there is a perspective when it comes to addiction that those of us on the progressive side of the political map ought to apply to all kinds of aspects, which is harm reduction. So, currently the mental health and addiction perspective is that you are either addicted or you are not addicted. And the perspective of harm reduction, as well as, for example, the reducing of racism, the reducing of inequalities, harm reduction as a perspective was incredibly enlightening. Second of all, it was really interesting that, to really ponder why it is that the Canadian nationalized healthcare system only looks at the human body from the neck down, and dental, optical, mental health is not included in that package. That's a huge detriment, of course. And then going back to addiction, he really helped me understand that the substance is not the problem. So whether it is alcohol or a television or sex or heroin, the substance itself is not the problem. The substance is an answer. It may not be a great answer, but it's an answer to a problem like loneliness, depression, isolation, and so on. And until we treat the social problems, we're never going to address the substance itself.
And you may recall, Lia, that he gave an example of Windsor and how, the number of persons who were seeking out assistance from mental health care professionals soared as the auto industry in Windsor was suffering a dramatic decline. And this sort of, and he kept stressing over and over again the role that stress plays in mental health issues, and in particular in substance abuse. And I think that this really highlights one of the things I took away from that conversation was the extraordinary importance of making sure that every single member of our society has their basic needs met. And this really means it's more important than ever, is one thing that I learned coming out of that conversation, is that we have a social safety net that does not let anyone fall through the cracks. And this is where the whole idea of a guaranteed basic income comes in.
For sure.
And one that's adjusted to the sort of the cost, the realities of, of life in particular communities around the country. Some communities, it's much more expensive than in others to meet the basic daily needs of citizens. And unless we have that, unless we have a social safety net that is ensuring that every single citizen's needs are met, then I don't think we're going to be able to effectively deal with the issue of substance abuse or the mental health care challenges of our country. We have to get to the root causes of it. And one of those is definitely insecurity, economic insecurity, and,
Sure.
and the various ills that follow from, for example, job losses, bankruptcy and so forth. So I think that was really sort of reinforcing the importance of a guaranteed basic income for all Canadians.
Yeah, and I want to really stress how insecurity, both financial, legal, and, for example, in your episode on domestic violence, the idea that home is not a stable, not a secure place. Insecurity is an incredible source of stress. And we know that the highest contributors to stress are money, health problems, status. I'm in Toronto right now. There's 300,000 roughly, who knows, undocumented migrant workers and undocumented people in the city alone, 300,000. So it's great that the Ontario government extended healthcare related to Corona to them, but having no legal status, having no security for the future, of course, all the levels of mental health and addictions are incredibly increased in those conditions. But I'd really love to hear what Wendy and Atul think about that.
I think before we get to the prescription of universal guaranteed income, I want to just spend a little more time looking at our much vaunted healthcare system, our much vaunted public healthcare system, which I think we all know has been eroded over the last 30 years. That safety net you talked about, Dimitri, that we all should be able to ultimately rely on has been nipped away at. There's been a lot of cuts and a lot of privatization that's happened around the edges and sometimes in the center. And I think until we address that issue of what kind of healthcare system we want, and not simply just rely on this historical notion that we have a universal healthcare system that addresses everybody's needs, we're not going to be able to really get to the next level of solution. So this issue was really brought to light for me during the pandemic with respect to elderly care, which has been privatized quite significantly over the last 20 to 25 years, particularly in Ontario, starting with the Mike Harris government. And now that's brought into full relief the reality that this belief that somehow privatized healthcare is more efficient and more effective is absolutely a flawed notion. And that's not only during a time of crisis, but that's on an ongoing basis. It just becomes more magnified during this time. So I think, I want to just spend a little more time with this idea of universal healthcare and really look at the ways in which it's been eroded.
The 83%, I believe, of all COVID-19 deaths have taken place in Canada in long-term care facilities. There was some excellent reporting by the Toronto Star recently where they compared the rate of infection and death in for-profit long-term care facilities in Ontario to those that were not for profit. You brought that article to my attention, Atul, and it showed that there was a vast disparity, and that the levels of infection and death in the for-profit facilities were much larger or higher than they were in the not-for-profit facilities. And so I think, that's just one example of the way, and it's one, as you mentioned, which has been extraordinarily evident to everybody who's paying any attention to what's happening in this pandemic. But there are others, and what I think when you add it all up, the ways in which the so-called public healthcare system in this country actually functions in practice, what we have is more akin to a quasi-public healthcare system. It certainly isn't a full-blown one. So, for example, the fact we should have pharmacare, there's absolutely no reason why, citizens should have to bear that burden by themselves. And the long-term care facilities should be, in my opinion, they should be publicly owned and managed in this country. This is an essential service. These are people, who are in these facilities who are amongst the most vulnerable members of our society. Many of them have spent an entire life working, contributing to the public well-being through paying their taxes. They deserve to have dignified and reliable care and to be safe and secure in their retirement. And it's an absolute disgrace in this country that we're seeing this community in particular, seniors, persons who are in long-term care facilities, being absolutely ravaged by a pandemic when we have the ability as a society to protect them, and we're failing to do that now. I think this is a dramatic demonstration of the ways in which our increasingly privatized healthcare system is failing to fulfill its mission.
The other thing that's being eroded is the whole issue of prevention when you think about universal health care and all of the benefits that we can get from prevention and education before it gets to the illness stage. And Gabor talks about the importance of community, and that's also part of prevention, having a safe community around you where you can receive the support and services that you need in a timely fashion so that it doesn't get to the point where it's a burden on the pathology-based healthcare system.
And this brings me, Wendy, your comments reminded me, of our conversation with Maureen Reed, and in particular how the isolation of women, all of us are being isolated, but women who are being subjected to domestic violence are particularly vulnerable and particularly afflicted by the increasing levels of isolation in our society. Can you talk to us about what you've experienced in the front line in terms of women being exposed to ever greater risk in this pandemic?
Well, I mean, it affects all aspects of their life. And since we're talking about health, the effects of abuse on a person are not only emotional, they can manifest physically as well. We see women who are experiencing diabetes, chronic fatigue, chronic pain, all kinds of issues. Obesity, eating disorders are common. So the violence affects so many aspects of their person, and it starts to erode their self-esteem and makes a woman feel quite worthless, and then she's less likely to look for help. And women that are isolated, particularly during COVID, are at much greater risk for harm and even being murdered by their abusive partner. So it's a scary time for women who are experiencing domestic violence.
And one issue that came up in our discussion with Maureen Reed was the way in which the justice system is failing women who have been subjected to domestic violence. And she talked about women they're just not in a position economically to be able to be represented by capable legal counsel. And I think that raises a very important issue about the crisis of access to justice in this country. Of course, it's not just women who are being subjected to domestic violence, but poor people generally are being affected by the crisis of access to justice. People in Indigenous communities are being affected by this, particularly in a criminal justice system that is incarcerating Indigenous persons at an incredibly high rate. In excess of 30% of Indigenous persons who are in excess of 30% of the people incarcerated in the corrective justice system in this country are Indigenous, but less than 5% of the population is Indigenous. Yes. So ultimately, a lot of this has to do with the fact that people in vulnerable circumstances cannot get adequate legal representation. So in my view, what we need to do is to address that head on. And the core of that problem is the cost of legal representation is beyond the means of the average citizen. This is not just true of people who are very vulnerable in our society. This is true of people who are middle-class income earners. And the only way we're going to get a grip on that is to actually put constraints on the incomes of lawyers. We have to come to grips with the fact, and I say this as somebody who practiced law in this country for a long time, and I came to recognize, seeing in the court system day after day after day, people trying to navigate through the thicket of the justice system without a lawyer to guide them, how this inability to retain a lawyer and pay for a lawyer is skewing the justice system in favor of persons who have power. And ultimately, if we don't address the fact that lawyers are charging too much money for their services, that's just the bald reality, we are not going to resolve the access to justice crisis in this country.
I just wanted to remind the audience that if you have questions for Dimitri, you can post on the Facebook page. You can also post in the live Facebook feed. And we actually have a live question right now from Yuri. Dimitri, would you like to address this question?
Yeah, I just got to flip my chat box. Or you can
I'll
just
read it out for you. So Yuri asks, how will you respond to those people who ask, how will you pay for expanded healthcare without raising taxes? And the fierce resistance that would likely come to incorporating mental health and pharmacare into public healthcare? Excellent question, Yuri. Thank you.
Thank you, Yuri. Well, I think when we look at the big picture of what the costs to our society are, for example, through privatized healthcare, we realize that the costs are much higher. Either way, you're going to end up having to pay the piper sooner or later. And the question is how much you're going to pay. So you can pay them through, you can pay for healthcare through a publicly funded system that is ultimately financed in large part by taxes. That's one way you can pay for it. Or you can pay for the medical provider directly, and you're going to pay a lot more. And study after study has demonstrated this. You know, the United States is one of the richest countries in the world, and it has the highest level of expenditure per citizen on healthcare in the Western world, and is also delivering outcomes that are inferior to those of countries like Canada. So let's take the example of pharmacare. You know, if we had a publicly funded pharmacare system, yes, there would have to be more paid in taxes to fund that, but ultimately people would be paying less money to these for-profit pharmaceutical companies. So then what we need to be focused on is not just the taxes. We need to compare whatever increase in taxation would have to occur in order to fund things like pharmacare to the current situation. And what we will find is that we're actually, as a society, going to save a lot of money if we do it on a not-for-profit, publicly funded basis. So before we go on, I'd just like to come back to Wendy and ask, because I admitted to ask Wendy something that was, I think needs to be addressed. Wendy, I understand that the Trudeau government recently eliminated funding for organizations helping sexually exploited women and girls. Could you elaborate on that? What exactly has happened, and what do you think the consequences of this are?
Well, we did have some funding from the federal government to support a program for women who have been sexually trafficked. And we were able to serve thousands of women and girls through that program, also assist their families try to locate them. We had a series of billboards that we used up by the 401. So there was a lot happening that was really positive and allowing us an opportunity to reach out to these young women in a very complicated situation. However, we reapplied for the funding as we were required to do, and we're denied and told that there was no money allocated for this cause, which is shocking considering that the federal government claims to be a feminist government and is ignoring this huge need in the community. So you know, the agencies that have been affected are getting together and responding, but right now the program is over.
And has the press been paying any attention to this issue, Wendy?
We did put out a press release this morning, and I'm afraid I'm not sure what happened as a result, but I hopefully they will, and we'll certainly take every opportunity to talk about it.
Right. Absolutely critical that we do that, and I know it's a really difficult media environment for us to get the word out about issues of this nature. What's being covered, of course, is all the money that's being spent by the government, understandably so, to deal with the pandemic. But we have to be very vigilant as a society to ensure that voiceless communities, for example, sexually exploited women and girls, are not neglected in a moment of national and international crisis. So thank you for bringing that to our attention.
Thanks.
I thought we would talk a little bit also. I think it's you know, one of the things that was very interesting to me in the first 5 episodes, and I just turn it over to Lia, when we interviewed Ed Augustin about the way in which Cuba's medical profession has responded to the pandemic, and the results in Cuba, as we discussed with Ed, both after adjusting for, you know, the population size in terms of infections and in terms of deaths from COVID-19, are dramatically lower than those we are seeing in the United States and even in Canada, but especially the United States. And, you know, Lia, based on what Ed had to say to us, what do you think is the explanation for that?
Well, first of all, from my recollection, Ed mentioned that per 1,000 people, there's significantly more doctors. There's also widespread access to healthcare. But what was very interesting for me was how information was getting trickled down. So for example, in here, you know, we're kind of at the whims of the daily press briefing of whether it's Trudeau or Doug Ford, and then seemingly endless barrage of facts, made up content, and all kinds of conspiracy theories through social media and everything else. And it seems that even in the mainstream media, where you have paid journalists and fact checkers, there's a whole slate of conclusions one week that then get contradicted the next week. And you kind of lose your ability to really know what is fact and what is not, what you should do, what you shouldn't do. If you remember the whole question of masks, first the CDC and the World Health Organization were saying don't wear masks because the healthcare professionals need them. And then recently they came out saying, yes, wear masks. So when one of the biggest crises of the COVID pandemic is the crisis of information and misinformation. But when you live in a country like Cuba, as Ed Augustin was describing, the information is passed both from the top down and from the bottom up through consultas, through public education on every intersection by people who are professionals designated for that particular area, whose job it is to answer questions of the population. So there's a much more direct information happening. So that's how, as far as I understood it. I mean, also, I don't know if Cuba and Canada are very comparable because, of course, Cuba is an island. So in the end of the day, it's significantly easier to control what goes into and out of the island. The population is less, and it's easier to also assess the movement of this virus throughout the island than in a country that's the second largest country in the world.
Yeah, and you know, you mentioned at the outset, Leah, the ratio of doctors to population. Cuba is, in fact, has the highest ratio of doctors to population. I was quite surprised to learn after speaking to Ed that Canada ranks 51st in the world. You know, even the Ukraine, Mongolia, and Kuwait have a better proportion of doctors to the population. And one of the reasons why I think we have that, and part of it is just a public funding issue, but I think another reason why we have that is that we have a lot of qualified physicians coming into this country, immigrating to this country, who are not being certified, who are having to go through extraordinary hoops in order to get certified as medical professionals. And meanwhile, you know, we're imposing these constraints on their certification, even though, you know, when you compare us to countries like Cuba, which have far less wealth than Canada does, there's a much higher proportion of doctors to the population. So I think we need to take a really hard look at the ways in which we can increase that ratio. I think it's unacceptable that we are 51st in the world, even though we're one of the wealthiest countries in the world. And it really speaks to what Atul was saying earlier, which is that our publicly funded healthcare system is really a quasi-public healthcare system. And in many ways, we are not rising to the occasion and do what we have within our power to do.
And I also was, sorry, I just wanted to add, you know, the disparity between Canada and Cuba, obviously those are not comparable countries, but the disparity of deaths per million is not just a small disparity. In Cuba right now, it's roughly 7 deaths per million. In Canada, it's almost 140. And I just wanted to add that a substantial part of that difference is because of the organization of the distribution of healthcare. So what Ed was saying about how neighborhoods are reclassified in terms of primary, secondary, tertiary risk, and the door-to-door doctors that go and reclassify week by week, attending through socially distanced ways, attending to the population, you know, week after week after week. That is a substantial difference from the way healthcare is provided here, where you could have it, you have no idea if you're a primary risk or not, and you wouldn't know because it's even difficult to get tested in Canada.
Absolutely. Atul, Wendy, any thoughts to add to that, the subject of the doctor population ratio or healthcare? I want to move on to some really interesting things that Kike Ojo Thompson had to say, but before we do that, If you have any thoughts you want to add, I'm happy to.
Perhaps a bridge to talk about some of the things that Kika brought up as well is that with respect to this resource of doctors that we have in this country, I believe in Ontario alone, there's 13,000 healthcare professionals that are uncertified, that are coming from other parts of the world. That's an estimate, about 13,000. I think it also speaks to a belief that still permeates our culture and perhaps our healthcare industry, and that is that certain people coming from certain parts of the world don't have the adequate training perhaps, or that our system is superior. And I think that is still rooted in a kind of colonial and to some extent racist discourse. That has to shift. There's been a lot of lip service that's been paid by many sectors, political sectors and political parties to trying to rectify this problem, to make certification easier, to make it less costly. To Lia's point, I'm sure doctors or those who have the credentials from other parts of the world would certainly go through a process of recertification if it was actually feasible and affordable. I'm sure they would be recertified on an ongoing basis. This is their work. This is what their training has been. But a lot of those folks are coming to Canada, have families, they have children, they have to make a living, and they don't have the time or the resources to jump over all of these hurdles. So we need to go beyond the lip service that's being paid to this, this lack of access for those who have the credentials, to actually moving in the direction of removing those barriers. And I think the Green Party can play a very, very important role, and you can play a very important role, Dimitri, in pushing for that, because that resource exists in this country. There's no reason that that ratio of people to doctors should be what it is, particularly when we have so many people, and that image is burned in our minds, all of us, that you've got the doctor who's driving the cab. That should not exist in this country.
Yeah, and I just want to be careful not to gloss over when I said certification. I mean, what we're really talking about is these people who have been heavily educated and trained are being, in many cases, obliged to redo their entire medical education, which of course, as you say, Atul, for all of those reasons you identified, is simply not an option to them. They just have to meet their daily needs, and they can't afford to be putting themselves all over again through a medical education. So Wendy, I think you were going to add something.
I was just going to say that lack of a family doctor exacerbates existing medical issues. So, you know, lots of the women that we see, you know, don't have a regular doctor, and it's a real problem.
Absolutely. So I wanted to move on to the question of, you know, diversity and anti-racism. But before I do that, I neglected to answer a question going back to the issue of access to justice from Matthew. Matthew asks, in addition to making access to legal representation affordable, what about preventative measures such as prohibiting private arbitration, non-disclosure and non-disparagement clauses in business employment contracts, and greater obligations for corporate transparency? I think that those are all important considerations, Matthew, but I think that one thing you've reminded me that I didn't mention, which is even more important than any of those things in terms of ensuring access to justice, is, you know, every time, and this is an experience we've all had, you walk into a Rogers store, you enter into a consumer contract with a large corporation like Amazon or something, and you know, they give you this document, they'll send you an electronic document that has been drafted by some very clever lawyer, and it's like 20 pages long. And all of us, we don't read those documents. I mean, who does? And the vast majority of us who do read them, and that's a very small proportion of the population in my view, they just don't have the legal sophistication to understand them. And so what we really need is to have a legal regime which imposes fair and equitable contract terms on large corporations dealing with ordinary Canadians who cannot go through the exercise, they can't pay through the exercise of getting legal representation. So we really need to have much more rigorous, I hate to use the term consumer because it reduces human beings to just, you know, consuming units, but we need to have much more rigorous regulation of consumer contracts. I think that would probably go a long way to addressing the concerns that Matthew is raising. So I'd like to now shift gears and go to an excerpt from our conversation with Kika Ojo-Thompson about the whole question of diversity. And specifically, she addressed the question in response to something that I asked her about how the Green Party in particular can be more welcoming to persons from racialized communities, both in terms of attracting candidates and in terms of attracting voters from racialized communities. So maybe we can play that now. Very important theme, and rightly so, in this leadership campaign. And I'm really curious to know from you, and I know this is a big question, it's a complex question. I imagine you can only touch on it very briefly within the confines of this, this program, but what do you think that a political party like the Green Party of Canada can do to begin to make candidates from racialized groups more comfortable running for our party? Because that's something that we all really want to see happen.
Yeah, I think, and this is going to sound strange, and I'll try to explain it. I think that the party needs to redefine green. So, obviously, the Green Party is about something obvious, and at the center of the issues for the Green Party is the environment. And I think that people need to feel like the issues that they consider to be life and death, like their issues of survival now, today, this week, next week, are also taken care of. And I really think that there's sort of a reputation then of, this piece around climate only. And I think as soon as the party can figure out how to break out of the idea of climate only, so that's one. I think that the green space, the environmental space, the climate change space has constructed itself in a way that really suggests that the people that matter are really white folks. And it's a particular type of white folk too, right? So this idea that the people that are doing this environmental work are white folks, and so it's a narrative that really leaves people of color, racialized people, and definitely Black people out, because it's sort of taking up environmentalism in a particular way. And what you don't see, so you and I were chatting sort of before, and we talked about the fact that I lived in Atlanta. I lived in Atlanta for almost 3 years, and I was leading the creation of an environmental justice strategy for the city of Atlanta. And there, it was about the justice work, right? The work around the environment was about environmental justice. So who's being exposed to what? Is that equitable? Even when you talk about natural resources, et cetera, the use and the pull on those sorts of things. And there's not a conversation, here in Canada as much, and in the GTA and in Canada at large, around the issues regarding environment. So
what's your reaction to that segment, Atul?
Oh, I mean, I think Kika's speaking some pretty powerful truths there. I think first and foremost, the goal is to actually create a different kind of political culture, one that isn't just speaking about complex issues or about supporting the lives and the needs of the most marginalized, but actually doing it. And of course, those of us who are trying to create that on the left, I think have our work cut out for us with respect to creating that space, that culture that is inviting to a more diverse group of people. Because politics, for the most part, I mean, I've been part of different political sort of moments in my life, are to a large extent dominated by sort of white culture. And so I think it is a challenge to really create a political culture that is from the ground up welcoming and diverse, not just sort of the sloganeering, which I think is easy, and I think a lot of the parties do that, but to really create those openings and spaces for people's real lives and real life experiences to be reflected in policy and practice. I think that's the significant goal that Kika is speaking to.
Yeah, I think Kika I totally agree, Atul. Kika was, although she didn't use these words, she was talking about the intersection of at least 3 of the 6 core values of the Green Party. Of course, or 4, I should say, there's ecological wisdom, sustainability, social justice, and respect for diversity. And what we as a party, I think, can do much better is talking about the ways in which environmental depredations, like greenhouse gas emissions, like toxic emissions, contamination of water supplies, are disproportionately affecting racialized groups. And because that is just the reality, and there's abundant evidence of that. And if we can do a better job of highlighting who are the primary victims of environmental depredations, I think that we will be able to speak to racialized communities much better.
I also think it's really important to redefine what we consider to be political work, because I think that the spaces that Kike is talking about, this white spaces that are so prevalent in activist circles, make invisible so much work, so much grassroots political work, so much radical, awesome work that's being done. And as a result, they also make invisible those people. And I think that, how we reconfigure that. So for example, to talk to Kika's point, what your team looks like has a lot to say as to what kind of candidate you're going to be, whether or not you personally have the experience of being marginalized or not. So diversifying teams is an enormous part of it, but it's also in terms of addressing education at the ground up. And just to go back to the original segment we showed with Dr. Gabor Mate, he was talking about including biopsychosocial education in medical schools at the trauma-informed, approach to mental health and addiction at the ground level in the very first years of the medical education in Canada. That's political work. How you get to reform these systems has to be intersectional. Who's doing the work has to be intersectional. And I think that that's part of the biggest challenge that's going to be facing the Green Party is it going to have intersectional, diverse leadership?
Absolutely. Yeah.
I think a big part of that is being aware of our privilege as well, and how that factors into community conversations.
100%. And in that regard, Matthew has asked another question. The Green Party a while ago sent out a diversity survey that included categories such as gender, religion, and income, but not race. How can we talk about welcoming people of color if we don't examine the issue of race within the party? That's an excellent question, Matthew. In fact, and this is what prompted me, it didn't appear in the segment we played with Kika, but what prompted me to ask her that question was in the last electoral campaign federally in last year, the National Observer sent a survey. This was not a Green Party survey, and that's what Matthew's talking about in his question. This was a survey from the National Observer to identify how many candidates came from racialized groups at each of the parties each of the national parties running the election. And it was very troubling to learn that the Green Party of Canada had the lowest proportion of candidates from racialized groups in that survey, including fewer even than the People's Party of Canada. So there is no question that we as a party have to do better, can do better in terms of becoming a more welcoming space for candidates and supporters and voters from racialized groups. I think we have to go into their communities. We have to speak to them. We have to understand what are the issues that are confronting them. For example, Kika talked in the interview, we didn't see it in the survey. She talked about carding. That's an issue that's very important in her community, the Black community. Police brutality is an important issue. These are not things that we normally think of as being within the environmental, the whole question of environmental stewardship, but they are nonetheless incredibly important to the day-to-day lives of persons in racialized communities. And I think that if we as a party begin to understand that and speak to their needs and the challenges that racialized communities confront, we can very quickly diversify this party and become the champion of diversity, which according to our core values is what we're supposed to be. And certainly what I as the leader of the Green Party of Canada would demand that we be. So I think we've been going for almost 50 minutes. I think at this stage, it's been a great discussion. maybe we could perhaps talk a little bit about what we would like to cover in the weeks ahead as we emerge from this crisis. One thing that I would like to talk about in the days ahead. Oh, I'm sorry. Before I do that, I'm being told that we have 2 audience questions that remain. But I don't see either one. Oh, here we go. So Azabi Muna asks, I'm concerned with the possibility of mandatory vaccination to resume our normal lives. Many people don't trust vaccination nowadays. Can you address this issue? So I see a lot of, concern about this online, and I think ultimately that we as a party, and certainly this is true of me, and I know that this is a view that's widely shared within the party, we ultimately have to be guided by science, and we should trust the scientific community. And I'm not saying that, that scientific community never makes mistakes, but we should be making decisions that are based upon evidence and empirical analysis and an expert understanding of issues. And if we have a body of scientific evidence that establishes the safety and efficacy of a vaccine, then we should be comfortable in, accepting the mandatory nature of that vaccine. It's absolutely essential to the health of our society. So ultimately, what I would urge people to do, who have concerns about mandatory vaccines, is to listen to the scientific community. What do they have to say? There's ample literature out there which addresses the safety and efficacy of these various vaccines. And I don't think, I'm confident in the medical system to ensure that if and when, and hopefully it'll be sooner rather than later, we develop an effective vaccine to deal with COVID-19, that we're going to be given the straight up facts by the medical community about what is safe and what is efficacious. So I would urge everybody, to place priority on the scientific evidence.
I just wanted to add something that you worked so hard for as a correspondent for the Real News Network yourself for a number of years. And this, I think, is at the core of one of the most fundamental pieces of popular education that's missing, and that's media literacy. So for example, there's a really great comedy sketch online called If Google Was a Guy. And in one of the segments, a person, instead of typing their question, actually asks this fake person a question. They say, proof that climate change is not real. And the guy representing Google keeps correcting, the scientific community, here's the stacks and stacks and stacks of proof that climate human imposed climate change is real. And the person keeps typing science proving climate change not real. And it gives them 1 page. And I think that kind of media literacy of what you can trust, what you cannot trust, especially in a moment of crisis, such as COVID, that is at the root of an informed public. So I just wanted to draw attention to your work as a Real News correspondent.
Thank you, Leah. I couldn't agree more with what you've had to say. And as we, as online sources of information proliferate, media literacy is going to become ever more important in ensuring that we have an informed citizenry. As I said at the very outset, collective decision-making is always superior, but that depends on a critical premise, and that is that the decision makers are fully informed. So we have to ensure that people are able to distinguish between, false information and accurate information, whatever sources they may be accessing. And we as a government can do that. We can take steps to do that without impinging on people's freedom of speech. So we have one other comment from Paul. He comments that deregulation of medical school tuition in the 1990s led to a change in who got into medical school. People from a wealthier background more entitled and graduating with a higher debt load. And he encourages making medical education more accessible to all Canadians, not just retraining physicians from other countries who are usually come from privileged class of their own countries. I don't think I speak alone here. I think I speak on behalf of all the candidates and the Green Party as a whole when I say that we feel very strongly that post-secondary education should be free. End of story. There's absolutely no reason why we cannot ensure as a society that anybody who wants to pursue a post-secondary education can do that without emerging from the post-secondary system with crushing debt. They shouldn't have any debt, as a matter of fact. You start out in life, you should have a clean debt slate and not have to be concerned about paying off your bills from, medical school or whatever other line of study you want to pursue. And so that's something that I think all Greens feel very strongly about. Paul, I can assure you that is a priority for all of us, all the candidates, not just me. And I got some good news from somebody. Anyways, relating. So, and by the way, I will address this now because I'm getting a lot of questions about this before we talk about our next few episodes. I am not yet on the Green Party of Canada's website as an officially declared candidate. That doesn't mean I'm any less serious about running than anybody else. It's simply a function of the fact that some of the candidates filed their nomination papers sooner than I did. In order to be up on the Green Party of Canada website, you need to have been approved as an official candidate. So my plan is to file that within the next few days. The hope would be that the party has approved me a candidate before the end of the month. So if anybody's got a question about that, that's the reason why I'm not on the party's website as of now. So in terms of the next episodes, we're going to address one thing, as I think I started to say earlier, a subject I'd really like to address is foreign policy. I think that's a very important issue that we don't talk about as much as perhaps we should in the Green Party of Canada. I know that, we also want to tackle questions of anti-Semitism, Islamophobia. These are questions, especially in the current environment where we're seeing a sharp increase in racism, not just against members of the Jewish community, not just against Muslims, but across the board, really, and it's extraordinarily troubling. So I think that's something we can talk about some more. What colleagues, anything else you think we should be tackling in the weeks ahead?
So many things.
There's no shortage of subjects, that's for sure.
Sure. I mean, obviously, the most pressing thing, I think, as we come out of this lockdown, as we come out of this government subsidized period in our lives, I'm very, very concerned about the very sharp increase in extractive practices and approval of extractive projects that the Trudeau government is likely to enhance in order to pay for all the things that were subsidized just now. Because of course, Canada's wealth is its resources, or at least what we've been capitalizing on is Canada's resources. So I would love to see you address the practical aspects of coming out of the COVID-19 lockdown without relying on extractive projects.
Absolutely critical. I agree.
What about you, Wendy and Atul?
I would love to for you to focus a little bit on militarization and the impacts on our country and others, and our role in our military, and address the peacekeeping issue. And
yeah, and that's a question of human rights. It's a question of global peace and solidarity, but it also is a question of relating to climate change, because the military is such a massive contributor to greenhouse gas emissions. And, we don't talk about that enough. How are we going to solve the climate crisis when you have a military run amok, spewing greenhouse gases all over the world with reckless abandon, and not having to pay for the pollution that it's created?
We certainly don't need the snowbirds flying over to thank nurses and doctors and other staff in the hospitals.
Not a fan. Sorry.
And traumatizing everyone who has lived through an actual war.
That's right.
Let alone those things cost $100,000 an hour to fly.
Wow, I didn't know that. Yeah. Atul, anything you'd like to see us address beyond what we've discussed?
Certainly. I think in keeping with the themes that I've been kind of discussing today, I'd like us to explore the possibilities coming out of this whenever that happens. It's going to be a slow process. For the kind of restoration of the commons in this country. And certainly what we've seen over the last 30 to 35 years is not just the erosion of our public healthcare system, but really the commons. And so to me, I think this opportunity, there's an opportunity here to bring back or take control over the discourse around the redistribution of wealth and the role of government in actually making society a better place for everybody. I think when I was growing up as a child, and I don't want to romanticize this, but certainly it was a different Canada in 1970 than it is today with respect to distribution of wealth, with respect to public versus private ownership, with respect to a sense of possibility that people had. And I think what we've seen is an erosion over the last 30 years. And I think this is an opportunity coming out of this crisis to wrestle back the discourse around what the role of government is and should be for the benefit of the entire society.
Right. Absolutely.
Public ownership is a really interesting topic to look at.
And I'm gonna
Fascinating. Yeah.
I'm going to plug a book before I go, just because I think it's it speaks to the very issue that you're discussing, Atul, and that's not that I have, it's not my book, but I've just read it. It's a great book by Linda McQuaig called The Sport and Prey of Capitalists, which talks about the ways in which publicly owned corporations have contributed immensely to the social and economic well-being of this country over the years, and how this has been eroded during our lifetimes. So that is definitely a subject that merits a very careful exploration.
And one more point, Dimitri. We have, as a group and as a campaign, are making great efforts to try to, move beyond this perception that the Green Party is a single issue party. Having said that, the environment is a significant issue, and it's never been a single issue in and of itself. It's a very complex, multi-pronged issue that touches political, economic, social aspects of our lived experience. And so I think it's really very important that in the near future, we do an episode really looking at the Green New Deal, and really start to look at what implications are coming from this time of crisis. What can we draw on in terms of looking at the climate crisis and as we go forward? Because I think there've been a lot of scientific discussion about a possible pandemic. We're now starting to become aware that people have been predicting that. But one thing we know for sure is that science has been telling us on a very consistent basis that we are facing some very serious environmental crises in the future if we don't change the course of action that we're on. And so I think this is a real opportune time for us to start really looking at the Green New Deal in a very focused way.
Absolutely. Well, thank you everybody for joining us this week. We'll be back soon. Look out for announcements about our next episode on my Facebook page, campaign website. And if you have any questions about the campaign, want to reach out to us, just want to know more about what this campaign is all about, please visit teamdimitri.ca. And I'm happy to chat with you online or offline, any of you who may have some questions which we didn't get to address in today's episode. Thanks very much. And in the interim, stay safe and healthy. Bye-bye.